So we'll move on to the panel session of this evening. So what we're going to be doing in this discussion is looking at the Indian-UK collaboration, specifically on healthcare, the opportunities and challenges that exist. And joining us for this discussion, we have three experts. So we're joined by Dr. Ajay Gupta, who's the Managing Director and Group Chief Executive Officer of Indo UK Institute for Health. We're also joined by Emma Sheldon, MBE, Group Marketing Director of Vernacare, and a board member with the UK-India Business Council. And finally, we have Rob Yates, who's the Project Director for the Universal Health Coverage Policy Forum, Centre for Global Health Security, working at Chatham House. So there's immense potential for the two countries to work together here, whether it's learnings from the NHS that could be applied to India, or looking at some of the low-cost resourcefulness, the low-cost innovations that are happening in India that could be possibly applied to healthcare services in the UK. But there are tremendous challenges as well. So what I hope to do in this discussion with our speakers is to look at not only what are the opportunities, but where are the challenges and how they might be mitigated. So to kick things off, I'll hand over to Ajay to share his thoughts.
Thank you, Champa. Good evening, everyone. The new Indian High Commissioner of the United Kingdom, Her Excellency Icici, the President of Indian Professional Forum, Dr. Mohan Kaul, Lords, ladies and gentlemen. It's a pleasure to be here today. For those who don't know me, I am Ajay Rajan Gupta. I'm the MD and Group CEO of Indo UK Institute of Health. This is a program that was announced by the Honorable Prime Minister Narendra Modi in 2015 with the view to open up national health service in India. Now, we all know that at 70 years of Indian independence, India has gone through a tremendous change in its economic growth, as you said, Your Excellency. However, the healthcare economics is still in crisis. And I today talk almost 12 months after my previous discussion on a subject quite similar to this. And at that time, India was undergoing a healthcare economic crisis in three aspects. Number one, affordability. Number two, availability. And number three, accessibility. Now, if you look at the affordability aspect of healthcare, almost 600 million Indians are driven into poverty and access of healthcare over 10 years. The healthcare inflation in India is almost 10% per year. If you look at accessibility, almost 1 billion people in India don't have access to a good infrastructure of healthcare. So we need about 4 million beds, and these are WHO standards. We need about 3 million nurses, 2 million doctors, and 1 million paramedic staff. These figures, by no average, are realistic figures. And these could be scary at times. So we are at a time of crisis. However, in the last 6 to 9 months, the Indian Prime Minister, through his entrepreneurial and innovative thought process, has come out with the Ayushman Bharat program, which ensures almost 500 million Indians. That, to me, is a revolution that India is at the cusp of, to deliver a healthcare which allows affordable access to almost 500 million Indians. What that brings to our Indian population, Indian family, is affordable healthcare of almost 5 lakh rupees per family. That is unheard of anywhere in the world, and I must congratulate Your Excellency and the Indian government for delivering that. And that brings me to the point that we now can say with confidence that the Indian government is working towards taking the Indian healthcare crisis out of its difficult time. Once we are out of the crisis, we're not here only to solve that. We are here to generate a future for healthcare, generate a future for India. So we, I think, are at a cusp where India can now leapfrog itself, not only in terms of bringing its position as a center of medical tourism in India, but delivering affordable, available, and accountable healthcare for its 1.2 billion Indians. Now, if I talk about accessibility and availability, because the Indian Prime Minister sorted affordability out, the biggest challenge has been how do we develop infrastructure in India that matches the demands. If you look at the PwC report just published last year, we need about $250 billion of investment into India to deliver healthcare to the market balances that I've talked about. $250 billion of a foreign direct investment into India is possible over a period of 20, 30 years. And that brought us to discuss this very important critical topic with the Indian Prime Minister in 2015. He just won election at that point. And Dr. Mohan Kaul sits on the chair of that program. The Indian Prime Minister at that point had a discussion with the British Prime Minister, Mr. David Cameron, and announced a landmark program called the Indo-UK Institute of Health Medicity Program, aimed at opening 11,000 NHS quality hospital beds across the length and breadth of India. Now, this was a joint statement between the two governments with the view that the two governments could work together over 2 decades. It's a 20-year program to deliver 11,000 NHS beds to cater to 400 million Indians. That was announced about 2.5, 3 years ago on the first maiden trip of the Indian Prime Minister to this country. Since then, we celebrated the first year anniversary when our Prime Minister Theresa May went to India, and we celebrated the second year anniversary at the Chogam this year, and we're due to celebrate the third year anniversary in November or December this year at the Indo-UK Future Tech Summit. Clearly, lots has happened over the last 3 years. The program, which started with initial seed capital of $60,000, has now been valued at $600 million. We are due to achieve a unicorn status later this year or early next year. We have now developed a very strong corporate governance of the program because of the fact that we have UK government and the Indian government sitting on the joint statement and a joint committee group that oversees the program. Principal Masons have been our legal advisors along with Clifford Chance. We've got PwC working as our corporate financial advisors, Ernst & Young as the program managers, and KPMG as the auditors, with the view that we can take the governance to India as well. We've partnered with NHS trusts across the length and breadth of United Kingdom. King College Hospital is a primary clinical partner. We've partnered with Sheffield NHS Trust, with Christie's, and the likes across the length and breadth of United Kingdom. Healthcare UK, that Emma you represent, is a very strong partner with us that helps to deliver the National Health Service standards across the length and breadth of this program in India. As you would know, ma'am, at the recent visit of the Honorable Prime Minister, he also announced a partnership to develop primary healthcare in India. And there is a statement that he alluded to about opening 5,000 clinics across the railway stations in India to support the primary healthcare across India. So we're now at the junction where India is getting foreign investment from this program. We're investing into India through a UK company. We are developing hospitals across the sites. We have signed MOUs with all the 11 states, of which are Andhra Pradesh, Karnataka, Telangana, Maharashtra, Punjab, Haryana, Odisha, West Bengal, and the likes. We have been allotted land in 7 states. These are large land parcels, about 150 acres each. We've acquired land, bought land across 3 of those in Hyderabad, in Amravati in Andhra Pradesh, and in Nagpur in Maharashtra. The construction has started in Nagpur, and we're going to start construction in Hyderabad next year. All the designs of the hospitals have been developed by King College Hospital and our institutional partners. We are, of course, trying to deliver the top quality NHS hospital standards across the length and breadth of our country. The objective beyond this project is, of course, it's a project that delivers profit to our investors. We deserve 20% of the beds free at the point of use for our patients. And that is the point we bring Ayushman Bharat into the program. So 20% of the beds are reserved for Ayushman Bharat, where anybody and everybody, irrespective of the caste, creed, or socioeconomic status, can walk into an IOH and demand treatment free at the point of use. All this brings me to the long-term objective of this project. Of course, the long-term objective of this program is to deliver healthcare which is affordable, accountable, and available, but that lasts beyond us, our generation. It leaves a legacy like the King College Hospital, 150 years old, which lasts in India beyond the constitution and the changes of politicians in or politics over the next 10 to 20 years. We, over the next 15, 20 years, plan to give employment to about 500,000 Indians, and that's a study that's been done through KPMG. We are working on developing manufacturing units in India, and over the last 1 year, we've partnered with Zimmer, which is a large medical manufacturing unit, to open manufacturing of knee implants in India for Indian patients. We've also partnered with Stryker to open up a knee implant and a trauma center in India that manufactures implants for India. And the story goes beyond the 20 NASDAQ companies we're partnering with. We're also partnering with IBM to open up a data center of excellence to look at data for 400 million Asians, to look at innovation and technology. I'm not going to talk about this forever, but we are now, I think, at the cusp of changing the Indian healthcare and using the UK-India healthcare collaboration to bring this to reality. Well, thank you very much.
I think Ajay touches on a really interesting point where one is the government-to-government cooperation then between health systems, but also there's an important role here for the private sector given the scale of the need that's needed. So with the work that you do, are you able to speak to the role of the private sector and what it can do to foster collaboration, but what some of the challenges may be there?
Yeah, thank you very much. So I am the ex-marketing director of Vernacare, who is an SME business who were operating in India. I'd like to talk about that. I'd also like to talk about the work I'm presently doing at Healthcare UK, which is creating something called an export catalyst for the NHS organisations to help them with capability and capacity issues that may exist to help them to access the Indian market. And the third element I'd like to touch on is technology and healthcare technology businesses, which I also work with smaller startup or scale-up organisations to help them understand the Indian market and to get their innovations both to and from the Indian market. So just to start with the SME experience that I have, Vernacare are a healthcare business that I worked with until 2017. And the work that we did in India was very exciting. The main reason it was so exciting was because we were able to explore the market and really get to a segment which suited us. But once we were selling into the Indian market, what we really found was how much it changed our global business models and how much it changed some of the technology that we worked with. And I think that's a big lesson. Those lessons came from the challenges that we experienced in the market, exactly to your point, on how to deal with such volume, how to deal with supply chain, and how to deal with getting your products into the market and getting them used in a way that you would anticipate them being used. So some of those challenges led to very significant innovation. The second thing I'd like to talk about is the Healthcare UK work that I'm currently doing. So Healthcare UK is a part of Department of International Trade, and as part of a response to the capability and capacity issues, we've created an export catalyst, which is a function to allow NHS organisations to get training, to get support, to get education, to get connections, all of those, on the global market, but particularly in India as well. We do focus on that. So if anybody would like to talk about that later, I'd be more than happy to. And the third thing is health technology. So India has a hugely growing health technology sector. And I think that with the technology from the UK and India collaborating together, it's such an important time now to make sure that those technologies from the UK and India are working together to really get the benefit across all the things that I've talked about. How can we bring SMEs on board? How can we make sure the NHS is working to help reach out into India, but also take those innovations at scale and make sure that the digital agenda is leveraged as much as it can be. So it is person-to-person relationships. That's ultimately what it is. And I look forward to working with many of those organisations on that.
Rob, I guess the dream for many would be universal health coverage. And I guess the question is, there are so many stakeholders potentially here working on India. So we're talking about the UK-India potential for collaboration here. But that's private sector, it's university level, it's hospital to hospital, it's government to government. And how do you pull all of that in the same direction? Because if you look at the Gini coefficient for India, what you do have is staggering levels of inequality within the country. So how do you design a universal or work towards universal healthcare coverage in such a way that you can reach the most vulnerable, the most marginalized, in order to really capitalize on the demographic dividend that India could have?
Thank you, Champa. You're hitting upon the really big issue, and every country in the world at the moment is working towards universal health coverage. It's driving the global health agenda. In a couple of weeks' time, there's going to be the very first UN UHC Day. It's in the Sustainable Development Goals. And it's really exciting because you see the head of WHO really seeing this as his priority too. And I've been working in India for about sort of 10 years now with the previous government and with the current government too. And you're seeing that this sort of step change interest in universal health coverage and moving towards that system. I'm actually a political health economist, you know, sort of working on the political economy of these things, because as you allude to, there are lots of stakeholders involved and lots of different views as the best way towards this. I think one thing that has been agreed now, though, that if you're going to achieve universal health coverage, it's you've got to do all the health systems reforms around more medicines and HR and IT, but it's absolutely vital to get the financing right. Health financing is at the core of universal health coverage. And it's really recognizing that if you're going to have a system where everyone gets the health services they need without suffering financial hardship, and you mentioned the huge numbers of the Indian population have been plunged into poverty because of out-of-pocket expenditure, you really have to force the healthy, wealthy to cross-subsidize the sick and the poor. And that really means moving towards a public financed system, predominantly publicly financed. Now, it's not to say there isn't, say, some private insurance on top of that, but you really do need to be moving away from a system that's financed out of out-of-pocket expenditure and private voluntary insurance to one that is much more socially geared, that the rich subsidize the poor. Now, India, I think if you look at sort of fairly recent trends, has been a bit slow to react to that. And I think in 2000, if you look at India and China, both were spending about 1% of GDP in public health spending. Since then, China's trebled. It's now 3% of GDP and steaming towards universal health coverage. India has flatlined at about 1%. And out-of-pocket expenditure is about 70% of expenditure. But you're seeing in the reforms being announced by the Prime Minister now an attempt to move away from that, to switch to a publicly financed system, which is really commendable and great. I think one issue, though, we have to sort of think about and discuss is that when the government is talking about getting serious about publicly financing the system, to maximise the efficiency and equity of that spending, and to get the balance right between trying to cover everyone and very much focusing on primary healthcare services, and the dangers of maybe being skewed too much towards inpatient hospital care. And if I may sort of express some slight worries about the announcement about the Ayushman Bharat reforms, I know there are two pillars to it. There's the 150,000 health and wellness centres that the government has announced, but also the big headline is around 500 million people having access to inpatient care, up to, I think, 500,000 rupees per year. Without getting the financing correct and really sort of helping the population realise that it really is better not to go to hospital in the first place, and that it's much better to treat things in a primary care facility, that's the way that you get best value for money out of the healthcare system. And of course, there are going to be the incentives at the moment to oversupply services. If so many households are sort of being given this entitlement to half a billion rupees worth of 500,000 rupees worth of treatment a year, they will be thinking, oh, I'm sick, I must go to the hospital, I must stay in a hospital bed, and the costs will go up. So I think it's very much a matter of looking at the balance at the moment, and that perhaps this is an area that we in the UK will be able to assist with. I mean, the NHS isn't perfect at all, and we're not sort of suggesting that the NHS model should be accepted lock, stock and barrel. But one of the real foundations of the NHS is its very strong family doctor tradition, the idea that you trust your family doctor and they advise you when you go to the hospital, and you're not allowed to just walk into a hospital and see expensive specialists. And so this might be an area that we can help with, but also maybe looking to your neighbours. You know, Sri Lanka, Thailand, you know, have had a big focus on primary health care. And, you know, these could be the things that you might want to look at. But it is definitely commendable that the government is taking UHC seriously. It's just very important to spend the money as efficiently and equitably as possible.
I think it shows the importance of looking at health systems in its entirety, from preventative health through to secondary care that's needed. I mean, we're only able to really scratch the surface of some of the issues here, but if we open it out to the audience to see if you have any questions specifically on the healthcare aspects or the potential, or where you see opportunities in terms of India-UK collaboration.
Thank you very much.
If you could say your name and who you're with, or if you're just yourself.
I'm with you all. I'm Dr. Ramesh Mehta. I chair the Indian Doctors Organization in UK. There are approximately 60,000 Indian origin doctors working in National Health Service, and we are known as the backbone for the National Health Service. We are of Indian origin, and our heart is still in India. So I think it's a brilliant discussion, and thanks, Dr. Cole, for inviting me here. So far, you discussed about the stakeholders in the private sector, the politicians, the King's College Hospital, but there is a huge role of voluntary sector as well. So just to give you some examples of what we are doing as a voluntary organization of 60,000 Indian doctors. There is a huge shortage of medical workforce globally. So the NHS contacted us and asking our help to bring Indian doctors here. And we said, yeah, we can do that, but that's the brain drain. India also needs the doctors. So we have a collaboration with NHS. We bring Indian doctors to train here because skills training in UK is one of the best in the world. So we give them skills training and send them back. So there is no brain drain, but also improved skills in specialty organizations. We were also contacted by Indian government, the Ayushman Bharat, and I think it's a brilliant thinking of bringing this in. So 150,000 primary care centers to be opened. We have approximately 10,000 doctors who have been working here in primary health care and just about retiring, and some retired already. So we are thinking of sending these doctors at least for a few months to man some of those 150,000. Where are you going to get all the medical workforce? And Ajay, you know, you're doing absolutely brilliant work. We're very proud of you, of what you have done, taking the NHS governance system into India. So my suggestion is, I'm not going to go on and on.
I just wondered if there was a question there.
Yeah. No, this was the comment.
Okay.
I wanted to make this comment, especially we have the new, Her Excellency, the Indian High Commissioner, and hopefully I'm going to meet you, ma'am, very soon, to see how we can expand the voluntary sector as well to assist the healthcare collaboration.
I think it's a really important point about people-to-people exchanges, because certainly there are challenges there. This is not just about the UK going into India, but certainly in terms of Indian professionals or skills coming into the UK, people are, I'm sure, very familiar with the visa challenges that exist. But you're absolutely right, it has to be reciprocal. It can't be seen as a one-way kind of collaboration. But I wondered if there were any thoughts that you wanted to, or any kind of reflections?
Thank you, Dr. Mesh. Thank you very much. I think what you've spoken about resonates very well with the ethos across the room, but across the two governments. I, being an Indian like yourself, have passion for my country. We want to deliver this for India. I have been thinking very strongly with my team about using the voluntary sector in the healthcare, especially in the United Kingdom, but also through your role in GAPIO, on a global association. There are lots of Indians in America, doctors like yourself in Britain, who have the same thought process of doing voluntary work. And I've asked our partners, our consultancy group, to work on a working paper. How do we use this voluntary group to give us time? Of course, there are proposals across the working group, whether we should ask them all to give us an hour a month, which allows to almost 60,000 hours a month from just Britain. And if you add that up, that is almost a lifespan of an individual that could be given to the program through various conduits. So we are working on how do we deliver that. That could be either a policy think tank, where we can have organizations like yourself to give us that thought process and could partner with us. There could be either consultations for the poor in villages across the 150,000 centers, which could be teleradiology. And we are working with 2 organizations on a very large scale to deliver healthcare where we don't have manpower. And that is one of the biggest challenges India will have in years to come.
Or woman power.
Or woman power, yes. Of drainage of manpower across the world, but also of not generating as many doctors as we need in India or workforce. So, but thank you very much for your offer, sir. We are working on it.
But part of that is sustainability, and I think it goes back to Rob's point about public financing or how you design these health systems to make sure they're sustainable, because you can't also be entirely reliant on the goodwill of others also. Yeah. Did you have a question?
My name is Subhas Thakra. I'm former chair of the London Chamber of Commerce. Thank you very much for a very, very interesting presentation and a very useful, interesting discussion. This morning I was at another event where we were discussing the digitization of the NHS, which is a real challenge. And really what I think was emerging is that it's pretty slow. And I think this is where the great opportunity of India, UK comes up, because India is so good at digitization. And Britain is so good at the health skills that are there. But we shouldn't be looking at India following the same steps that Britain has followed about NHS, because it is a behemoth, it's an expensive vehicle that we've got, and we keep making it a political hot potato all the time. And I think India needs to leapfrog, as it has done in other technologies, to do that. And thinking needs to be applied in that area. And I don't know what thoughts you have in that area.
Maybe if we start with Rob and then Emma, the role.
Yes, and with respect, I would slightly disagree with you about the politicization. I mean, I think that really, you might say that the NHS has been successful because it's such good value for money. That I agree it is a lot of money, but we spend about 8% of our GDP on our health system. I think on the financing, it's very important to recognise that it is better done by the state, because the alternative of sort of depoliticising and saying, oh, we'll let the free market, control things, is you end up with a US-style health system, which India really doesn't want to go that route, because, that costs twice as much and so much more is spent on administration. So I think what we're learning on the financing around the world, that it really is much better for the state to have a huge role in the financing, in raising the money progressively and spending it. Now, definitely, you want to get better value for money out of that in terms of good IT system and digitization. And here I would definitely agree with you that don't look to the NHS for that, because historically we haven't been very good at that. And I think you've got much better expertise than us. So I think in India's situation, it is a matter of looking around the world at who does what best. And, so I think is it the Estonians, I think, are brilliant on health information systems. So I go to Estonia, maybe, talk to the Estonians about that, and the Japanese about cost control. They're absolute wizards at that. I think for the NHS, the greatest the attributes of the NHS are its family doctors and its financing system. It's by far the cheapest and the most efficient and equitable way to tax finance your system.
Emma?
Yes, thank you. I think, I think if we look ahead, both both systems are going to have hugely radicalised change over the coming decade. And I think that that's going to happen because of digitalisation, and we're already seeing some of those things, happening in the UK with AI and diagnostics, and the way that we might deliver some of the challenges that Rob raised around primary care. The Indian system should look to not mimic the NHS and some of the challenges they've had about accessibility there for technology, but how can we open that up? And the UK can then learn lessons from that. So I think it is very much, a reciprocal situation where we shouldn't lose sight of the NHS model and the principles of it, but we should, open our minds to kind of more of the accessibility and the speed of adoption and play that back into the UK as well.
We have a question here.
Thank you. My name is Lopa Patel. I'm a journalist for New Asian Post. I'm fascinated, but can I ask a really simple question? And the question is about antibiotics. As I think probably the audience knows, antimicrobial resistance means that our antibiotics are not working. And two of the biggest countries which are contributing to antimicrobial resistance are India and China. Yeah. So what are we going to do when the drugs stop working?
Simple, but quite complex as well. We're actually looking at this at Chatham House at the moment, looking at the two, because they have very different health governance models. So it's an area that we're exploring at the moment. How do you deal with that challenge? But
yes, just some thoughts on that. And of course, it's multifaceted, sort of about regulations and restricting access to antibiotics. But one very key finding I think it was the Lancet Infectious Diseases, looked at different health financing systems and saw a huge correlation between countries where people are buying medicines over the counter. Sort of people feeling unwell, going into a pharmacy and a pharmacist saying, oh, here, have sort of 3 of the pink ones and 5 of the blue ones and hope you feel better. Now, that is a recipe for disaster and for antimicrobial resistance. And so it's very important that, the state does have a huge role in buying medicines and deciding who gets what and for what conditions. And so again, this is another strong argument for sort of socialising your health financing system. Here in the UK, you can't march into a pharmacy and just buy antibiotics like that. So it's very related to this issue of the financing and taking the purchasing function away from individuals who make bad choices and instead giving it to governments who make better choices.
well, you'd hope so.
It tends to be.
Yeah.
Yes, thank you, Champa. Thank you very much for that question. I think that's a very, very important point. That's going to be a big challenge in times to come. Antimicrobial resistance, whether it's Staphylococcus aureus, which is MRSA, or vancomycin-resistant enterococci, that's going to be a challenge not only for a developing country like India, but also a developed world like the United Kingdom. And I think there's a 3-pronged strategy that's been thought of, and there's a joint working group between the United Kingdom and India, which was announced by the Honourable Prime Minister at his bilateral visit just in April this year on antimicrobial resistance. And then they've got a funding of about $5 million, not enough, but it's a seed funding. And that talks about a 3-pronged strategy. First, of course, is identifying the reasons why India has deli bugs, which are now being found to be resistant to both methicillin but also vancomycin. So it's this next stage level of resistance. So what are the reasons behind drug resistance more in India? And one of the reasons is the bottom of the pyramid uses antibiotics from common pharmacists rather than a tiered, gated system of antibiotic usage. The second is, what do we do to prevent that microbial resistance? And third is, what do we do to bring new drugs into the pipeline by the pharmaceuticals like GlaxoSmithKline or Pfizer or AstraZeneca or Novartis to make sure we've got a continuous pipeline of drugs. What's happening in the last decade is that we've got a lot of drugs which are either finishing their 10-year horizon and therefore are going into generics, which India is pumping on a very large scale across the world. But there aren't too many new drugs coming into the market for the simple reason that they don't have enough time period to make the revenue or the investment grow out in terms of revenues. So that's the third challenge. But you're absolutely right. There is a lot of work to be done on this particular field.
Oh gosh, all the hands have gone up and we're out of time. So if we take very quickly your questions, and then maybe if you could take one each. So we have 2 hands there, and one in the corner there. If they could be quick questions, that would be great.
Me? Hi, I'm Prabhakar Kaza, General Manager, former General Manager from State Bank of India. So I lived, of course, for 5 decades in India, 3 decades working in State Bank. I think we are ignoring the value of our CGHS, Central Government Health Scheme, one thing. 2, we should also look at the state government hospitals. 3, we have a large number of private hospitals which are financed in a very, very big way nowadays in India in different cities. At the end of the day, if you look at any foreign investment that comes, it's only for profit. And in my opinion, of course, it should be minuscule. In any country for that matter, whether it's UK, US, Western Europe, anywhere if you see, the foreign investment that has come is very little in healthcare sector. And when it comes to voluntary, the number of doctors who are doing voluntary operations in India runs into a few millions. Absolutely charitable stuff. Voluntary sector from outside is, in any case, minimal. Brief question. Thank you.
Thank you. If we take the one behind.
Namaste, I'm Rajiv. I'm a GP and I've worked in rural India for some time as well. My question relates to the NHS and one of the strong points of the NHS, which is not only it's publicly financed, but it's also very integrated. Now, one of the norms in India is that if it costs more, it must be better. So, for example, a private corporate hospital in India has exactly the same radiotherapy machine as the NGO down the road, but it bumps up the prices to about 20 times more. Now, actually, it's those norms that legitimize that private institution. And what legitimizes that private institution is also the collaborations that we create with them. So can we move towards a standard by which we collaborate with health ecosystems in India, such that they're not just vertical secondary care hospitals that cost a lot of money, but actually healthcare organizations that do their bit in rural areas of India as well?
Thank you. And there was one more here.
John Mason, a UK-based doctor. I was wondering, does India have something to share with the UK in terms of holistic and preventative care, coming from the traditional Indian background in medicine? Thank you.
Mm-hmm. Right, you have 1 minute or less to answer. Do you want to take the NHS one?
Okay. I could answer all 3, but I could start off with Rajiv's question in terms of integrated healthcare. Yes, that's the demand of the hour. India has a very well-developed secondary and tertiary healthcare, while the primary healthcare is still nascent. And there's a need for us to develop both the primary and the secondary and tertiary and integrate that together. And that's something that we, as an IUH organization, are working on the hospital, but also in the clinics program. The challenge, of course, lies in the transparency of costs. And I talked about right in the beginning of my talk about 3 A's, the accountability, affordability, and availability of healthcare. And whilst we talked about affordability through Ayushman Bharat, the availability through the large infrastructure development that IUH and the other hospital groups are doing, the accountability only comes through transparency of cost. And with Ayushman Bharat coming in through the Honorable Prime Minister's initiative, the time is not far when every hospital will have to be very transparent with the pricing. So if a nuclear medicine scan is done in a hospital like IUIH or in a hospital which is down the road, maybe an NGO, the price has to be at par. Because the government will only fund you a particular amount, which was not the case earlier. If you think of the hospital like CGHS hospital schemes, or for that matter, the other ones that we talked about earlier, that transparency was there, but the price points were very low. And therefore, most of the government sectors could provide you healthcare, but not of the right quality, which is the accountability part. But you're right, in years to come, India is moving towards a transparent pricing system where I think all the hospitals, whether they wanted it or not, will be forced to accept the Ayushman Bharat level. Because almost 500 million patients, or half of India, is only going to go to the hospitals where the pricing is right.
Rob, Emma?
Yes, well, just really address some of these issues about the balance and the integration. I think one of the great announcements made by the Prime Minister was an increase in public financing from about 1% of GDP to 2.5% of GDP by 2025. Now that would be fantastic, but I think anyone interested in health in India needs to be holding the government accountable for that. I mean, dare I say it, that the previous government said very similar things in 2012, and it flatlined. It stayed about 1%. So I think everyone needs to be sort of just checking that the extra money is going into the system. But then it really is around getting the balance right between the tertiary, primary and the secondary care. One's worried that the balance at the moment is very much towards the inpatient insurance systems. I mean, I know there's the talk of the health and wellness centres, but the budget allocations to those this year have been pretty minimal, to be honest. And unless those resources get into those health centres next year, you can see that the big emphasis is going to be on the tertiary sector. And then there's a real worry that you'll blow the money on the hospitals. And this has happened a bit in China, where, you know, despite the barefoot doctor tradition, there is this fascination of people wanting to go to hospitals all the time. So I think, you know, it's vital that the integration happens right from primary, secondary and tertiary. And there are some interesting things happening at a state level in terms of investing in cost-effective services, things like the Mahala clinics that the Delhi state government are doing. It's very interesting, where you're seeing that these health centres, I think there are about 170 of them, they've seen about 8 million people, and people have returned from the unregulated private sector to access universal free services in the Mahala clinics. Now that's very interesting. Now, I know this is quite a hot political issue between the Delhi state government and the central government, but the central government might want to look at that and then model the health and wellness centres on that. And then I think there's tremendous potential for the resources going to where they'll be used most cost effectively.
I think just to the point around, you know, what the NHS and what the UK has to offer India, I think across the board with SMEs and the technologies that exist, you know, really innovative NHS work, universities making a huge changes. I think it's just about really knowing that India is a fantastic market to operate with and within, and, you know, to encourage organisations from SMEs right through to universities and NHS to do so, and to do so with some gusto. So that's all I'd say on that.
Well, that seems a good point to end the conversation on. Unfortunately, we're out of our time, but I'm going to hand over very quickly to Loknath Mishra, who's CEO of Icici Bank, who's helped sponsor this event to help close the evening.
Thank you.
But before we do, if we could give a round of applause to our panel.
Thank you. I think what I was watching it from behind, and what a discussion. I think so much passion into it and so much of energy into it, and the kind of questions. I think it's really interesting debate. Thank you all for making it so lively and so interactive. I think health is a big issue in India. I think a lot of opportunity for the two countries to work and collaborate together. I think NHS as a system has it works like a well-oiled machine, but there are something to learn from them. But at the same time, there are some of the issues which we need to address, because probably that's something which may not work in a country like India. In India, as we discussed, Prime Minister has launched a very ambitious program for universal health, covering 100 million families. I think for country like India, cost is a big issue. Coincidentally, it so happened that I was talking to one of the entrepreneurs today morning, and I don't know that, but he mentioned that from the chain, from the pharma company to the consumer, almost 80% cost is with the intermediaries. And he said they are working on a model to see how do they deliver it directly to the consumer or to the doctor. They're not sure. They feel that given the industry dynamics, it makes sense to deliver to the doctor at least, And then, of course, after that, hopefully, it gets passed on to the consumer. But those kind of disruptions are significantly important for a country like India. How do we achieve that? Because we want to achieve the best of the possible healthcare at a cost which is, while it's already low, but can we do it at a cost even lower than that? That's the beauty of our country, right? That's what we always want to achieve, the best possible thing at the lowest possible cost. And I think huge opportunity. I think that's for good measure has come up as a big discussion point and big point for debate. And I'm happy that this debate has happened here. ICICI Bank has always partnered in terms of India-UK corridor, both in terms of trade and investment. And we are pleased to partner with India Professional Forum. Thank you, Dr. Kaul, for organizing this. I think it's a very, very important initiative, and we are pleased to partner that. Thank you, Her Excellency, for gracing this occasion. I believe this is your first public engagement here. Thank you so much for being part of this important initiative. Thank you all my friends, colleagues, and other dignitaries here for joining us. Please join us for reception in the first floor over drinks and snacks. Thank you so much.